Now this is the PowerPoint that we're going to show you now. It's a follow-up on the treatment of the angiogenesis seen in the previous PowerPoint. This is about 6 weeks post-treatment. I wanted to show you the progression and how we treat it when we see the patient the second time. Now this is about 6 weeks post-treatment. You can see a nice resolution. There's still some angiogenesis on the medial aspect of the thigh inferiorly. Now, at this point in time, our treatment options are the following. We could do tumescent only. When you do tumescent only, the theory behind that is that you're actually causing some shrinkage of the vessels. And since angiogenesis is an inflammatory process, it will be gradual resolution. Now, tumescent subdermally doesn't last a long time, so I like to use other modalities such as sclerotherapy, rarely Van Gogh, and rarely laser. The wavelength of the laser has to be such that it will actually target these vessels. These are small, hence a YAG laser probably would not be effective. Sclerotherapy is always effective as long as you can get the needle into the vein, so that's what we're going to use here in our treatment for the second treatment session. Now this is about 6 weeks after we treated the angiogenesis. It's had some clearance, still has a little reticular there we'll do, plus inject this and do tumescent. So, I mean, just have to keep following up on this stuff and figure out what's causing it. Right here you can see this flushes out, so we'll inject 0.1 foam here, liquid here, or we can do 0.1 foam and then tumescent to the whole thing. That's what we may do. Okay, ready? Go. Now this is, I tried to inject this reticular, but it's clotted. So we're just going to inject the little spider complexes with foam. And just fill up the little complexes, the little spider veins as much as we can with foam. And then put tumescent underneath it. So most of this should be gone. Now you can see here, got a little bit of clotting in the vessel. So we're just going to make a little nick. And we're going to flush it out. Otherwise, you'll have a little too much staining there. So let's have a flush. Now we're going to flush. Some of this stuff out. You can see it coming out of here. So any place that you can get in, these are quite small now, but you can see it flushing out. Okay.